Let's be honest. Every medical assistant has had that one moment where a patient snaps at you, raises their voice, or shuts down completely, and you're standing there thinking, what did I do wrong? The truth is, you didn't. Difficult patient interactions aren't a sign that you're a bad MA. They're a sign that you're working in healthcare where fear, pain, and uncertainty bring out reactions even the patient doesn't understand. And that's exactly why empathy and communication skills aren't soft. They're clinical tools, just as important as taking vitals or documenting accurately. Here's why this matters. Studies show that nearly 40% of patients report high anxiety during medical visits, and anxious patients are more likely to appear difficult. On the MA side, around 70% say dealing with emotional or aggressive patients is one of their biggest stressors. So, when you learn to handle these moments with calm, empathy, and structure, you aren't just making the day easier, you're protecting your emotional well being and preventing burnout. So let's break this down in a way that you can actually use tomorrow. First, lead with emotional awareness, yours and theirs. Before you respond to a tense patient, check your own internal state. If your heart rate is up, your voice will follow. Slow your breath, soften your shoulders, and approach at a calm pace. Patients often mirror what they see. Then acknowledge their emotion without taking it personally. Try phrases like, I can see this is really frustrating, or I hear that you've been waiting longer than expected. This doesn't mean you agree with their behavior. It means you're grounding the conversation so you can guide it. Second, use the E.A.R method. Empathize, ask, reassure. This is a framework many MAs swear by because it's simple and works across urgent care, pediatrics, primary care, and even telehealth. Empathize, name the feeling you notice. Ask a guiding question to understand the root issue. Reassure, give them one clear next step so they feel supported. For example, I understand this pain has been scary. Can you tell me what makes it feel worse? Thank you. I'm going to let the provider know right away so we can help you. 3 steps, 40 seconds, huge difference. Third, protect your boundaries while staying compassionate. Empathy doesn't mean absorbing disrespect. You can be kind and firm at the same time. More than half of MAs report feeling emotionally drained by aggressive encounters because no one taught them how to set limits. Use calm boundary statements like, I want to help you, but I can't do that while being yelled at. Let's work through this together. You're not escalating, you're resetting the tone, and most patients respond better than you expect. Here's the reminder you need. You're not responsible for fixing someone's entire mood or life situation. You're responsible for guiding them safely through their visit. Empathy is about connection, not sacrifice. So save this if you want to strengthen your communication skills. And remember, every time you handle a tough interaction with grace, you're growing into the kind of MA patients never forget. You've got this.